Elder Rivera, how you doing today?
Doing pretty good.
Pretty good. That's a good attitude. I won't shake your arms off or anything right now, but so tell me what's going on.
Well, I was out trying to share the gospel for my church. I go to the Church of Jesus Christ of Latter-day Saints.
And, good for you for saying the whole name.
Thank you. And we knocked on a door. We were trying to go visit some people, and they gave us this address. I knocked on the door, and when they opened, it was somebody else, and he was very angry, and I couldn't really understand him. English is a new language for me, and he started yelling, and then he just started swinging a bat at me. So I have I got a broken bone here on my forearm, and some ribs here as well. And then my collarbone on this side, and then my back. I'm not sure what's happening back there, but it hurts. Mm-hmm. So I have this nice back brace on.
Uh-huh.
So, but fortunately, there was nothing too serious. It seems to be healing okay.
Yeah, some people are kind of crazy like that, but I'm glad you're okay and nothing too serious. Mm-hmm. So just looking through your form here, I got your paperwork you filled out for me. So you noted some complaints with sleeping. Mm-hmm. I'm just assuming that's just new due to the pain.
Right.
Okay. Get that down there. And it's what specifically do you think is keeping you up? Is something like one of the injuries keeping you up more than anything else? Or is it?
No, I think it's just all of them in general. I'm just kind of uncomfortable.
To be expected with what's going on there.
Mm-hmm.
So I see that you marked that your symptoms are changing with cough or sneeze. I'm imagining that's with the ribs, chest there.
I imagine that's what it is.
Okay. And then you talked about experiencing some dizziness or vertigo. Could you tell me a little more about that?
Yeah. It just seems like when I get up in the mornings, as I sit up, it's like the room starts kind of spinning for a little while. It only lasts probably a minute, maybe less, but it's pretty consistent every morning.
Okay. And are you feeling any like pain with that, or is it just dizziness?
No, it's just dizziness.
And was this happening before your injuries?
Mm-mm.
Okay, so it's new with that.
Yeah.
Okay, we can do a couple tests just to see what's going on there. Okay. Could be sometimes your blood pressure just has a hard time keeping up with you as you stand up. It has to start fighting gravity. Mm-hmm. And so sometimes when you sit up from laying down for a long time, could be that. But we'll explore that a little bit for you.
Okay.
And then you also mentioned that you've had some episodes of nausea and vomiting. Can you tell me about that?
It's happened a couple of times. It doesn't seem to be associated with anything. I don't have really any more information on that.
Okay.
So I guess it's just happened a few times.
Sure. And did it feel like anything like provoked it, or is it just?
Well, it was kind of associated with the dizziness. I was just so dizzy that it did cause the nausea and the vomiting. But other than that, there was nothing else happening. It was just maybe I sat up too fast in bed or something. Sure. I don't know.
Yeah, and we'll have some things that we can look into that as well. Did you actually vomit, or was it just nausea? Don't know.
I don't have a lot of information for you on that. I'm sorry.
No worries. That's okay. We'll just move on from there. And then so I see that you're taking Motrin. About how often would you say you're taking that?
According to the doctor's prescription. Okay. Every 4 to 6 hours.
Okay. And just like 2 pills, probably. Okay.
Yeah.
That's the most important thing, as long as we're following that.
Yeah.
So we got this. Mark, that's your biggest thing. So tell me a little bit about your pain. So I saw that the worst it's been is 8 out of 10. Mm-hmm. And then 10 being the worst, 1 being, or 0 being nothing. You said right now you're about a 6. Is that a specific area, like in your arm, your collarbone, or is it just kind of all over?
Just kind of all over, I'd say.
Okay. Nothing's hurting more than the others right now?
No.
Okay. And that's to be expected. I mean, they're all fractures, so it makes sense. Their pain's pretty normal and pretty at the same, level, but if you start feeling more pain in a specific area, whether it's, while we're doing some exercise or just in general at home, let me know if that changes, okay?
Yeah.
Good, just kind of going through here. I see that you're having some pain when you're breathing deep, coughing, sneezing. and then sitting for about 30 minutes. So again, coughing and sneezing, is that in the rib, or is that kind of, I mean, I could see how it hurt other areas as well.
Yeah,
so.
I mean, it hurts my collarbone a little bit too, mostly
Okay.
just my rib though.
Sure.
A little bit in my back.
Good. And the medications help lessen your pain. If you said, does it drastically help, or is it just like more when you stop taking it, you stop feeling the benefits?
Yeah, I would say more when I stop taking it. That's when I start to the pain definitely gets worse. But it doesn't get rid of the pain when I'm taking the medicine, but it helps.
Takes it down to about a 6 or so.
Yeah.
Okay. Thanks for sharing that with me. And then you marked that your symptoms are improving and you're starting to feel more stable.
Yeah.
Good.
Yeah.
Good. Remind me, was it about a week ago when this happened?
Yeah, it was a week ago. I just got out of the hospital 3 days ago, so.
Okay. I'm glad to hear that you're at least able to get out of hospital.
Yes.
How's your home environment treating you? You live with your companion.
I do.
Tell me about that setting a little bit.
Yeah, so we're just in a little apartment together, and if you know anything about our church, we have to stay together all the time. So
Yep.
he does help me around with stuff, but we did actually just meet recently, so I'm new to this area, but yeah, he's able to help me around, and we don't leave the apartment very much, so just right now while I'm healing.
Yeah, I actually am a member of same church, so yeah.
Well, okay.
We're on the same page. I actually never served a mission, so I can't relate as much.
Oh, one of those guys.
I know. But yeah, so I don't know everything about it, so don't treat me like I should know everything about a mission, but I am a member of the Church of Jesus Christ of Latter-day Saints. That's not full nowadays. So I noticed on here, about your occupation. I'm assuming you're referring to your mission currently.
Yes.
You said it's moderately physically and emotionally demanding. Could you expound on that? Are you talking physically, emotionally, both?
Both. I mean, more. I mean, I don't think that the emotional necessarily would affect what's going on here.
Right.
But I mean, it is a little bit emotionally demanding, meeting new people all the time and trying to share most personal thing to me. But as far as physically, we are either walking around or on bikes all day long, every day while we're tracking. So it is physically, I mean, I can't just sit around at home and still continue to do these things.
Yeah, I was actually going to bring up biking a little bit. But so just before we move on to it, emotionally, it feels like you feel the effects of a mission, but you feel like you're handling it all right, or are you feeling like you might need a little extra help?
I think I'm doing okay. I'm just ready to get back to it.
Sure. Good man. And if anything comes up again throughout the series of our treatment, if you start feeling like you need a little more help or you're just feeling kind of down for an extended period of time, bring it up to me and we can definitely talk about some other options. But it sounds like you're doing great, so not a concern right now. So tell me a little bit about your typical day. I know, it seems like a lot of times now missions are kind of moving to vehicles a little bit more than biking. Do you guys have a car at all, or is it just still bikes and walking?
We do have access to a car, but we typically are on our bikes most of the time.
And so obviously, with the injuries we have, we're probably not going to go to bike for a while.
Right.
Have you talked to your mission president about that at all?
No, not specifically, but I mean, I can talk to him. We might be able to, use the car a little bit more frequently.
Yeah, that would be our best case scenario. I mean, we're going to do everything we can to get you back, but at the same time, we need to make sure that you're healthy and safe. That if something happened and you crashed on a bike, that we wouldn't start over at ground zero here. So we need to make sure that we're fully healed before we get you back up on the bike. But we'll move into that, and we can kind of talk about some goals that you want to get back to. But first, I just want to run through the rest of our list here. No tobacco, alcohol. Good for you. Yeah, I imagine that would bring up several issues if that was a problem. And so here you listed your goals of physical therapy is just to decrease pain, increase strength, and then return to volunteer work. Is that right? Could you tell me a little bit more about your volunteer work?
I mean, I'm just talking about as a missionary. I just want to get back to tracting and be able to get out and serve some more.
I just wasn't sure if there was any service projects or anything like that you've been related with. No.
Nope. Just tracking. Sure. Just walking around meeting people.
Yeah. So let's talk a little bit about what it's going to take to get back to where you want to be. Obviously, decreasing pain. That one's not too extensive. So ultimately, and staying with increasing strength, good goal. You're in the right place for that. Let's talk about returning to volunteer work. So I think, kind of take me through your day. So I think riding a bike is something we need to be able to tolerate. Do you agree with that?
Yeah, I think that would be ideal. I don't always have to ride a bike. It's not.
Right.
It's just I'd like to have the access to the bike so that I can go a little bit further away from my apartment. So.
Absolutely. So we'll work on that as well. How about? I mean, I imagine you're pretty limited with how much you've been allowed to use your arms.
Yeah.
How's hygiene, making food? How are things at home going there?
I'm starting to get the hang of not being able to move very much. I can't move this arm very much because of my collarbone. They told me not to raise my arm up very high.
They were correct.
So I kind of try and make it work. I do have my companion here, but I try and do most of it on myself.
Sure.
As much as I can.
Yeah. Good, and that's good. Yeah, I mean, the big thing with the collarbone is so it starts here and hooks in right up here, and it actually kind of hooks in to your scapula or your shoulder blade.
Oh, okay.
And so we need to be careful moving your shoulder in general because it's hard to move that shoulder without moving the shoulder blade as well.
Yeah,
and so when you start kind of moving like this, that's when that scapula or the shoulder blade and then your collarbone are going to start moving a little more.
Okay.
So what you said is fine. Moving that elbow, that's okay. But so my orders here on that right arm is non-weight bearing. What that means is we don't really want you picking up anything with that arm. Even though that elbow's moving okay and the wrist's moving okay, we don't want you picking up heavy weights because that's going to transfer through to your shoulder and cause some issues there. So I know I'm kind of taking away the arm that's moving the best right now, but definitely want to make sure that we're not overdoing it. Okay. Same with the left hand. Left hand, you are cleared to move your elbow. It's going to be a little tricky because that's where our break is, and so we still, if the elbow's okay, doesn't mean we can hold something in your hand. If the elbow's working, that force is still going to be going through that bone that we broke, so we got to be careful with that, okay? But it sounds like you're doing well. Still, washing hair, little things like flipping an egg. Listen to your body. That's not going to be a ton of weight, so you can probably clear that as non-weight bearing. But it's going to have to be a small little movement of this kind of a deal, not not scooping the whole pan up and doing the chef move or anything.
Okay.
But it sounds like you're doing the right things. And have you talked with your doctor about these precautions previously?
Yeah, he mentioned it to me.
Okay, good. And that's so we'll keep pounding in India, but it sounds like you're doing fine so far. Do you have any questions for me before we jump into things?
Yeah, not really. No.
Really good. I think I covered all the things I wanted to go over for you. So now I just want to, I saw in your history marks that you haven't had any issues with blood pressure or anything like that. Because, and you didn't have any family history, that's great. Because of your dizziness, there's a couple things I want to run through. First of all, I just want to take your blood pressure in general. And then usually I would go through and ask a couple other questions and check everything first. But just for sake of time, I'm going to check your blood pressure, and then I'm going to have you sit for about a minute, and then I'll have you stand up. And as soon as you stand up, I'm going to check your blood pressure again, just to see how we're doing there, to see if that could be causing some of your dizziness. I imagine we won't get a ton of results of it, especially if you're not feeling dizzy from just sitting and standing up. It's just in the morning, but just to be safe. Is that all right with you?
Yeah.
And so how I plan to do it is I want to put it on your left arm, because we don't have anything going on above it. We just have that broken arm down there. Is that okay with you? And before I put it on, I'm actually just going to squeeze your arm just a tiny bit above the break, just where that cuff would be. Just make sure that's not going to cause you any pain. Is that okay with you?
Yeah.
Okay. So let's just get a little test, just to make sure. Maybe a little squeeze. Very soft. Any pain with that? No? Okay, good. So we should be safe. Obviously, normally I would want the patient to have arms on their chair. I know I stole the one with arms, but it's going to roll away during other tests, so I put her on this one. So that's why we're here, but just note that we would want feet on the ground, obviously arms relaxed. Okie dokie. So, I'll be extra careful with you here. You mind if I pull the sleeve up just a tad bit?
No, it's fine.
The arm feeling okay?
Yep.
Good. And if I may, I just want to feel the pulse right here. Is that okay with you?
Mm-hmm.
And I'll be extra soft. Just let me know. Are you feeling any pain with that?
Nope.
Good. And I found that pulse already. So Not going to take much pressure, so what I'm going to do is I'm just going to kind of get a little sweet point here. And I'm just going to keep my finger here, and I'm just going to take your heart rate for a minute. So beat your heart normally, okay?
Yeah, of course.
Good, right at about 30, so about a beat per second, right in a good range. What we'd expect for somebody who's riding their bike every day. So
Yeah.
now I gotta look like a doctor for a minute here. So I'm just gonna bring this around and kind of push it up on the side of your arm. I'm gonna push a little bit in, but let me know if that pressure gets uncomfortable for you, okay?
Okay.
All right there?
Yeah, that's okay.
Okay. (106/76), looking great. Okay, so we'll get this guy off. Actually, we're gonna keep it on. I forgot. I told us we're gonna have you stand up. So, just a minute here. Let me kind of get all situated, and so we don't want to take it immediately. Everybody watching here, we don't want to take it immediately so that you can't even see what I'm doing, can you? I've been doing a great job.
I've been trying to.
So we'll wait just a minute, kind of let your blood pressure kind of return to normal after you squeeze that arm, and then we'll have you. So we'll wait, and so let me get this kind of in the spot. And so I just want you to ease up and just stand up for me, but make sure we're not stressing the back, collarbone, or anything. Just
Can
feet.
I have my companion help me?
Yeah, absolutely. That would be perfect. Yep.
Awesome.
You guys can hop up for me. Good. (102/76), so it did drop a tiny bit, but nothing that we should be concerned about. Easily get that guy off. Yeah. Good. Okay. Companion's still there. Okay. And we'll sit you back down. Thank you for letting me check that for you. Again, just to make sure that's not something that we need to be worried about. Dizziness standing up. Looks great though. So, mark that down really quick before I forget. All right, perfect. So just looking at you, I don't see any problems with skin. Obviously, you're pretty modest, so I can't see much. Is there something that you've noticed, anything like rashes, cuts, bruises, anything I should know about?
No.
Okay, good. So the next thing I want to do is I took the pulse on your left arm. Do you mind if I take pulse down here on your right arm just to make sure we have good blood flow? Perfect. There it is right there. And then I'd also like to take a pulse. It's right down here on the toes. We have a back fracture, so I just want to make sure that none of the blood work in your abdomen or anything like that's thrown off. Is that okay with you?
Yeah.
Okay. And let's take these at the same time. Good. Got them both.
Cool.
Looking good. So the next thing I'm going to run through is these are called they're called dermatomes, and so derm means like skin. And so basically what we're going to do is I'm just going to be tapping at different spots of your skin just to see if it feels the same on both sides. So I'll say same or different about 100 times. You just let me know if it feels different. So
Okay.
just say same every time it does, different if it doesn't. And this just does make sure that all of our nerves are intact, that we haven't had any kind of damage there from the injuries, okay?
Okay.
I am going to start up on the side of the arm, but it's just going to be a little light tap. So it shouldn't be painful at all. That sound good to you?
Mm-hmm.
So go ahead and close those eyes for me. Good. I just want to see same or different.
Same.
Good. And then same or different.
Same.
Same or different.
Same.
Same or different.
Same.
Same or different.
Same.
And then let's see, same or different there.
Same.
Good. And then here, just to make sure we're being thorough.
Same.
Good. Okay. Now we're gonna go onto the legs. First one's just gonna be on the inside of the thighs, and then we'll kind of go down around the foot, and then just in the knee pit to end. Is that okay with you?
Mm-hmm.
Okay. So just there. Same or different.
Same.
Good. Same or different.
Same.
Same or different.
Same.
Same or different.
Same.
Same or different.
Same.
Good. Alrighty. Easy so far. So just to make sure, on the right arm, I just see you pull your wrist up, down, open those fingers for me. Good. And then on the left arm, and I just see up like this. Just bend your elbow as much as you can.
You want me to take it out of the sling or just?
Yes.
Okay.
Sorry. Forgot about the regular sling.
Yeah, I don't have my prop for you.
Yeah, that's okay. Yeah, so take it out of the sling. So we're just going to be for a minute. We just want to see. I've been cleared to move your elbow a little bit.
Okay.
So just show me how much you can move it. Just kind of straighten her for me. Good, and I'll kind of guard here. Good. And then back up. Having any pain here?
I mean, not anything other than the fracture.
Okay, good. And then that's all I really, let's see, shoulder as well.
Okay.
And I see you just up as much as you can. Nothing hurting that arm. That's hurting there?
No, it just hurts down in my ribs a little bit. Smooth it up.
And then how about coming straight out for me? No problems there?
That's okay.
Good. All right, and then we'll get the sling back on you. Good. All right. And that's just, I want to see kind of a baseline of how much we're moving beforehand.
Okay.
And then opposed. So for the watcher, I'm not going to do manual muscle test or passive range of motion just because I don't want to put any stress on any fractures or anything. So we just did a little bit of active range of motion just to see kind of a baseline. Get a little bit, we had about 90 degrees, both abduction, flexion. Part of that's because of guarding because of the ribs, and then normal motion for abduction, adduction, or opposition, reposition. Nope, that's with the thumb. What is that called?
Finger stretching.
Yeah. Oh man. Well, I'll bring it up in like 10 minutes when I remember.
Shout it out.
Yeah, pretty much is what's going to happen. But then wrist flexion and even extensions looking pretty good. Kind of baselining from both joints. Anyway, moving on. Pad and ab. Sorry, I got to move on from that. It's going to drive me crazy. So I do want to test just to make sure nothing's going on with the spine back there. I think we're okay. I want to just test the strength of your legs while we're at it, just to make sure nothing's going on there. Is that okay with you?
Mm-hmm.
Okay, so I'm going to kneel in front of you, and then I'll have you do a couple motions, and I'll push. And I just want you to let me move you from the position I have you in originally. Does that sound good?
Mm-hmm.
Okay. So I just want you to pick the leg up off the foot. Don't let me move you here. Hold, 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 hold. Good. Other side. Hold, 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 hold. Good. Now kick this knee out straight. Good. Hold, 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 hold. Good. Other side. Hold, hold, hold. Good. Now bring the whole ankle up. Good. Don't let me move you. Hold, hold, hold. Other side. Hold, hold, hold. Good. Now just the big toe up. Yeah, that's okay. Hold, 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 hold. Good. Down here. Same side. Hold, hold, hold. Other side. Whatever. Point toes down for me. Hold, hold. Good. And hold. Perfect. All right. Looking great down there. Lower extremity myotones. Not too worried about it, but figured we should throw it in. Nothing abnormal there. So looking pretty good, other than what we'd expect to see with some fractures there. So that's good. Nothing out of the ordinary. So the next thing I want to take a look at for dizziness, I just want you to do something. So I want you to just look back like this for about 30 seconds. Good. In a perfect world, the chair head would not be that high. Obviously, I don't think it would be. But good, and we'll hold it for 30 seconds. And tell me what you're feeling right now.
I feel okay.
Okay, good. Now keeping your head back, I want you to look over to your left. There you go. Whew, getting tricky. Good. How are we feeling?
Feeling okay. Okay, starting to get dizzy.
You getting dizzy like this?
Starting to get dizzy.
Okay. How about the other side? So look the other way. Feeling okay there?
Yeah, that's fine.
Okay, good. Thank you for telling me that. So, was that scripted, or was that okay? Just checking, just making sure that has some big implications.
Yes, it does. And if I just made that up, that would kind of script your whole thing.
No, that's okay. So, that tells me a couple things.
Okay.
So, it means probably what's happening is we have something going on with your neck as well. So you're not in danger here or anything right now.
Okay.
But what it tells me is there could be something going on more than just the shoulder that we need to probably get you back to your doctor and have them take another look at you.
Okay.
Make sure everything's okay. And I'll give them a phone call, just let them know what's going on. what that is probably what's causing the dizziness is that motion, and it can just be cutting off a little bit of blood supply.
Okay.
Not something we need to panic about or anything like this, but it is serious enough that we want to get you back to your doctor pretty quickly here. So I'll give him a call. We can finish up seeing you. Question?
I'm just afraid that I may have led you astray with my response to you. Can I clarify that as a patient?
Yes.
Are there any other tests that you had already planned on doing for the dizziness, or did my answer already just cut you off and you know what to do now?
I could look at other things, but because of what I suspect, I probably would be very, very gentle on your neck.
Okay. So I was instructed that if you were to test the nausea while I'm laying down, when I turn my head this way, I have nausea, and this way I do not.
Okay.
So I think I was thinking that the test did the same thing, and I guessed, and I shouldn't have.
No, that's okay.
Sorry.
No, that is just fine. I actually, for full disclosure, I had planned to do some vertigo testing, so not a problem there. Thank you for clarifying.
Okay, sorry.
No, you're okay. That kind of takes it from being a artery issue to probably more of a vertigo issue.
I didn't hear anything about my arteries.
Okay,
so.
that's okay. Good deal. Thank you for sharing.
Yeah,
hopefully that's not too much to share. But so I do want to check a couple things for your dizziness, but while I have you here, we talked through goals. So the last thing I'll kind of have you do is we'll walk you through dizziness a little bit. Okay. But before we get there, so you mentioned it's kind of painful to cough. So there's some techniques. The biggest thing is you can hug a pillow while you do this. You don't have to, because obviously you're not going to have one everywhere you go. But it's instead of doing the full cough where it's like a, you want to do a huff, where it's a kind of a thing.
Okay.
It makes it so you don't build up the pressure and then let it go. So you might find it's not quite as effective as a standard cough, but you'll still be able to get what you're trying to get done finished with that, and it won't be painful. Okay. So it kind of just breath in. So give her a shot for me. It's just like a huff. Good. Feeling as much pain there?
No, that felt a lot better. Okay.
Good. So yeah, that's just a little tiny technique.
Okay.
And then something I want to talk about is body mechanics. So that it's kind of what it sounds like. It's how you move your body. And then it's like different ways to move your body. So as we're having you move through things, because of everything that's going on in your shoulders and your spine, I don't want you to be doing positions like this.
Oh, okay.
Right? Because that's going to put some pressure. And so this is kind of the area where we're expecting those fractures to be.
Yeah.
And so anything that's going to put a lot of pressure on there, we don't want to do. But if something happens where you do need to bend down and grab something, we want to keep a good body where we have chest up and then your backside kind of sticking out, and we're just coming down like this, like kind of like a squat.
Okay.
Things like that. So just kind of avoid these movements because that's going to put pressure through your shoulder here as well. I mean, the arm should be okay there, shoulder, and then rib is going to get moved, and then also just the back of the vertebra there. Okay. So we'll kind of walk through that. But again, it's just making sure we're bending with the legs, not the back. Good clean squat, keeping chest up, and then coming back up if something like that's happening. Okay? And then we'll practice that in a minute. The last thing I want to talk about before we get you up is something called diaphragmatic breathing. Okay. And so with this arm, again, don't move the shoulder too much, but I just want you to put your hand on your stomach a little bit. Okay. And so what I want you to focus on is typically we'd have the other hand up here because it's in a sling, we won't worry about it, but I just want you to focus on breathing into that hand, pushing your stomach out when you take a breath, and out. So rather than filling up the chest, filling up the stomach. Good. And that's a good way, in general, that's a healthy way to breathe. Something that this can do is if you're feeling relaxed, if you're feeling tense, that'll help you kind of relax your muscles and decrease some of the pain that you're feeling, but it will also kind of help the way you're breathing through your ribs. Because if we're expanding the chest here, you're going to be moving your ribs a lot more than if you're doing here. So what's happening is instead of expanding the chest and forcing your ribs to rotate back, we're just making the diaphragm move more. So you're giving your lungs more room down instead of the lungs moving out. Does that make sense? Okay. And so that decreases some of the pain you've been having with breathing, especially deep breaths. So just something to kind of think about. It's not something you have to, take a breath. Every single breath you have is a tummy breathing, is what I like to call it. But just kind of focus on that, especially if you notice that it's hurting while you're breathing. Think about that. Put the hand there, pushing your hand, and that should help decrease that happening, okay? So the last thing I want to take a look at is I do want to check something with your dizziness on the table. Are you comfortable laying on your back, or is that going to cause some pain for you? You lay on your back. Okay. So we'll have your companion help you on, and I'll help you as well. We'll get you on this table here for me. Gotta move some of our kid toys really quick. What's that? Yeah. Good. Yep, so we'll get you, and we'll have you just laying down on this side. Good. And so if you could, careful not to put too much pressure, especially on that right arm, but just kind of scooch to me so your head's hanging off a little bit, just in my hands, and I've got you here. Just maybe a little bit more for me, sorry. Just so we have about here. So come and touch my hand with the back of your neck. There you go. Good. Okay. So we're going to avoid doing the whole movement down because I don't want to be grabbing shoulders or anything. So what we're going to do here. How's that feel? Okay. About there. Okay. Let's try it one more time. The way I think you were cued. There. No dizziness?
Not yet. Okay, there it is. Now the dizziness is
Okay.
there.
Did he tell you if I should be seeing anything in your eyeballs at all?
Did not mention my eyeballs.
Okay. Just feeling a little bit of dizziness there.
Pretty dizzy. Everything's spinning.
Okay. So we'll just keep you here for a minute. I know it's unpleasant, but we're just going to stay until this dizziness stops, okay? Okay. So without moving your body at all, I'm just going to take you and move you here. Good. Same kind of thing. Do you have any more dizziness here? Good. And then because of the broken collarbone on the right side, I'm not going to have the patient do the full movement all the way down. So I'll just bring you back up here. And companion, help me out here. Go ahead and sit up.
Oh, I'm sitting.
Oh, I was going to sit you up, yeah.
Oh, okay, sorry.
You're okay, sorry, I didn't everyone. How are you feeling here?
I'm okay sitting up just like this. This is not how I usually sit up. I usually kind of just roll out of my bed. That's when I feel like the most dizziness, though.
Sure. Well, I'm glad that we're not having any more here. So in the clinic, we would wait. I don't know, hopefully I'm right on that. I mean, obviously, I feel a little weird about not completing the entire maneuver. But at the same time, I'm not going to have somebody with a broken collarbone roll onto that collarbone. So I guess we can talk about that more. But so I wait about 30 minutes, and we're going to do it again.
30 minutes or 30 seconds?
30 minutes.
Oh, wow.
So,
that's a long visit. Okay.
Yeah. and on initial evaluation, we might not do this.
Okay.
This would just be protocol for treating what's going on here. And I'll explain to you what's going on in a minute. So we'll say we had the 30 minutes to do it. So I'm back again. So this time I'm going to take you down a little bit quicker here, okay? So I'm going to take you right from here down. So I've got your head.
Right.
Okay, and so we're just going to lay you down. Ready? And go ahead. Lay. Good.
Okay.
And just relax. That was ugly on my part. You're doing fine.
Yep.
Okay. Good. And wait till the dizziness stops.
Later.
Good.
That side's still fine.
Good. So we'll just take it. Let's save about another 30 seconds or so. Good. Now it's been 30 seconds. And we'll help you sit back up again. Companions here. Good. Okay.
Am I good to come down?
You can come down, or I can talk to you up there, wherever you want to be.
I'll just turn so I can sit up there.
So basically, what I think is going on there is there's something called vertigo.
Okay.
And so basically what happens is we have little rocks, and they're inside your inner ear. And what they do is they kind of help you determine gravity, right?
Okay.
So if you've noticed, if you ever jumped on a trampoline or jumped into water from a high place, when you close your eyes, you can still tell if you're moving.
Uh-huh.
And that's what these little rocks do.
Okay.
Sometimes they'll kind of get displaced from where they're supposed to be, and they'll move into something called the semicircular canal. It's kind of hard to vision, but it's a little tiny tunnel. It's got fluid in it. And when that fluid moves, that helps you tell where your head is in space, right? So when you're moving like this, when your eyes are closed, you can tell your head's here because of that fluid moving. However, when those rocks get moved in there, that starts to throw you off and makes you very dizzy because of the displacement of the fluid.
Okay, and what is fluid?
What is fluid?
Yeah, I just don't know that word yet.
No, that's just fine. Yeah, that's a bigger word. So it's kind of like a little like a water or kind of like a liquid. So it's kind of like, kind of like an oil type of a thing.
Okay.
Yeah, sorry, that was kind of a oversight on my part. But so it's basically, yeah, just water moving in there, maybe a little bit thicker than water. But that moving around. Hey, buddy, could you be careful kicking that, please?
Yep, make sure you're being soft.
Hey, please stop kicking it, okay?
I mean, I move so that it doesn't adjust the table when he's doing that.
Please just don't kick it, okay? But yeah, so in general, just that movement of the kind of like the water back and forth helps you know where your head is in place. But when we get the rock in there, it's kind of clogging things up, and that'll make you really, really dizzy, make you kind of sick.
Okay.
But so what we just did is we did little positions to kind of get that rock at a different angle and kind of just move through that canal and go back to where it's supposed to.
Okay.
So we can definitely do some more treatment with that as well, because it's not necessarily just going to be, hey, William, please stop kicking that. But it's not necessarily going to be fixed in one treatment or one appointment.
Okay.
But it's been shown that if we do this a couple times, it should just go away.
Okay.
So that'll fix your dizziness.
Good.
And then we'll also do some more work on you. The last thing I wanted to ask you, sorry, I know this is a little bit jumbled. Just before we go, just so we have something to measure, I have a little handout for you.
Okay.
And so it's just the modified Borg scale. So if you take a look at that, it's 1 through 10, just kind of talking about, so dyspnea is a big word for feeling out of breath.
Okay. Mm-hmm.
So if you could let me know, where do you feel on this scale of like the pain is restricting you from breathing? How would you say you're feeling? How much you can like get air in, or if you're feeling out of breath at all?
Maybe. Well, I think I'd say it's probably a 2 then. I guess
2?
slight.
Sure.
I just it feels like I can breathe okay. I'm just really I get tired very easily. Since I've been kind of just sitting for so long.
Yeah. No, and that's totally fine. I just wanted to see, kind of to compare as that rib heals to see how we're progressing there. So not a problem at all. Cool. Well, I think that calls it for now. So we'll do a little bit more treatment for the ear, and then we'll get you and we'll do some more. We have that bike that's not up high. It's just one of the bikes with the chairs. So next time we'll get you on that. We'll get you doing some exercise, kind of keep you in shape.
Awesome.
And then we'll do a few more things to kind of get the swelling and the pain down. That sound good to you?
Yeah, sounds great.
Right, perfect. Well, I look forward to seeing you next time. Thanks for coming in.
Okay, thank you.
You have a great rest of your day.
You too.